Hello, everyone, and welcome to Heart of the Matter here at Doral Health and Wellness. My name is Christina, and we're so glad to have you here joining us in today's session. This month, we're focusing on one of the most vital aspects of our health, our heart. It's a topic that affects every single one of us, and we're here to provide you with key insights and tips that could truly make a difference. We are incredibly privileged to have a very special guest here with us today, Dr. Babak Hassid, an esteemed cardiologist and expert in his field. He's here to shed some light on how we can better care for our hearts, prevent heart disease, and live a healthier, longer life. Dr. Hassid will guide us through the essentials of our heart health and what you need to know to stay proactive about your cardiovascular disease. Thank you for joining us today.
Thank you, Christina.
Before we begin our discussion, I just wanted to introduce our guest. Dr. Hassid is an accomplished cardiologist with over 15 years of experience. He earned his medical degree from SUNY Upstate Medical Center and his interventional cardiology degree from Cornell. Currently, he serves as the chief of our cardiology department, and his dedication to patient care and his vast knowledge has truly made a special difference in our community. So thank you so much for joining us.
Well, thank you so much, Christina, for that wonderful introduction. It's been a pleasure for me to be here and have the opportunity to discuss such important matters and topics. Taking care of your heart is one of the most important things that anybody could do, and I'm looking forward to sharing some of my knowledge and experience with everybody here.
So Healthcare Unlocked, the heart of the matter.
Okay. All right, so we'll start with why heart health matters. So heart disease is one of the leading causes of death across the world. It affects everybody, all ages, genders, and the key to saving life is prevention, making sure you prevent heart disease. Excellent. So what are the few things that we could do to prevent heart disease? So one of the most simple things we do is blood pressure management. Blood pressure affects many people, about half of adults throughout the United States. It is directly linked to heart failure and stroke. And a lot of times it goes undiagnosed because it's a silent killer. People with high blood pressure could go on without having any symptoms. So when you come to the doctor, we check the blood pressure, you might feel fine, but your blood pressure might be elevated. So that's one key and easy step to start with prevention. Diabetes. So second leading effect of heart disease is diabetes. So about 2 in 3 people have diabetes, and when they have diabetes have a higher prevalence of heart disease. And it's closely related to obesity, inactivity. So sometimes I see a patient who is about 10, 15 pounds overweight, they lose 5 pounds, and the A1C goes down within normal limits. And lifestyle. So smoking is a very easy thing somebody could do to reduce the risk of heart disease. When you smoke, the nicotine goes into your blood system. It causes little nicks into the bloodstream, into the vessels, and causes that cholesterol in your body to stick, even be more sticky. So smoking causes those damages. So if you stop the smoking, you have less damage to your heart vessels and less chance of those cholesterol particles attaching to the vessels. Alcohol is another lifestyle modification that you could do. Obviously, everything in moderation. You could always have a glass of wine or two, but nothing in excessive. So what I focus on in my practice is the power of prevention. So when I see a patient, before we talk about anything, is how can we prevent cardiovascular events from happening to you? So one is healthy habits, focusing on non-pharmacological interventions, non-medications, which means diet. What is your diet? How can we talk about making you have a healthier diet? Simple. Exercise. And sometimes people think about exercise, you have to join a gym and run, a marathon. It's actually even brisk walking 20 minutes a day, 3 times, 4 times a week. That's considered exercise. Stress management, everybody has stress. We all have a lot of stress. How you deal with it, making sure you're not getting angry, because when you get angry and all that pressure, your blood pressure could go up. And regular checkups, seeing the doctor, checking your blood pressure, checking your blood work, and all that is what makes prevention key. All right, so we'll talk about healthy eating. So very simple. It's what we learned in elementary school and middle school health class. Fruits, vegetable, whole grains. Those are the most important things that we could do. Cut down on salt, sugar, trans fat, processed foods, and honestly, a lot of times it's eating out, takeout. Takeout restaurants, and a lot of the restaurants we eat at just cook with a lot of salt. So even if you don't add the salt into the food, they're already adding it in. So decreasing those takeouts will also help as well. Physical activity, as I said, physical activity is very important. It's not joining a gym, walking, maybe parking your car a little bit further from where you need to go and walking. That's always a good thing. That's what I like to do. I try to walk as much as I can. Activities such as swimming, yoga, anything that gets your body moving is considered exercise. And managing stress. So chronic stress, remember, increases your cortisol level, which impacts your blood pressure, which impacts clamping of your vessels, which is a cycle of events that happen. So if you don't get stress, the cortisol level doesn't go up, your blood vessels don't clamp down, and it doesn't affect the vessels in your heart, and you live a better life. So how do you manage a stress-free life?
I was gonna say I should have asked my husband to join.
That's a key thing. I think we all have stress, but again, if you could do it, manage it, whether it's meditating in the morning, whether it's reading a book at night, whether it's having a squeeze ball that you could have, if you could just manage not getting upset and stressful, easier said than done. I think that's something that's important. And again, know your numbers. Blood pressure management is very important. Sometimes you come to the doctor's office, we check a blood pressure and it's high. And then you say, oh, at home it's good. So you know what? It's okay to check your blood pressure at home. And what I always tell my patients is don't check at the same time every day. Check it once in the morning, and the next day at night, one day in the middle of the day, just to see what the range goes. And remember, blood pressure is not static. It shouldn't be all the same, but it shouldn't spike up too high at any point. So even if you ran over to the doctor's office and blood pressure is high, it shouldn't be above 200. It still should be within a normal range. And early detection saves lives. Remember, blood pressure is the silent killer. It not only affects heart disease, it affects your kidneys. It could, if you don't control it, you could have chronic kidney disease and lead to dialysis. It could cause damage to the brain arteries and cause a stroke. So if I could tell you 2 things that's very important for cardiovascular health is blood pressure control and diabetic control. Those 2 things, if you could control those 2 things, I could guarantee you a healthier, longer life. Okay, progress in care and treatments. So what I do in the beginning when I see a new patient and a new consult is, get a history, understand where the person is coming from, talk about their lifestyles and what we could do to make their lifestyle better without medications. But sometimes medications are needed. So, for example, cholesterol. We check blood work, the cholesterol comes up. We look at the LDL, which is known as the bad cholesterol. Obviously, we look at the HDL, which is a good cholesterol. We see a ratio, but the LDL, and if you want to get really specific, there's subdivisions of the LDL that are more have more damage to you than not. But if your LDL is above a certain level, I always say, you know what, we'll give you a 3-month chance of diet, exercise, and try to get your numbers reduced. A lot of times with cholesterol, it's genetics. Now, no matter what you do, you could reduce it maybe 15, 20%. But a lot of times it's just, even with the best regimen, the exercise, eating right, your cholesterol is going to be high. That's when I transitioned to start statin medications. I'm a big fan of statins, which are the Lipitors and the Crestors, and they really, in the last 30 years, with millions of peoples in trials, have shown that really reduces the risk of cardiovascular events. So not only does statins reduce your cholesterol number, but let's say we do a test and there's some plaque in your arteries and it's not significant yet. That cholesterol medication, that statin, stabilizes what's there and prevents it from getting worse. So one of the things that we do is, yes, diet management, exercise, but once that isn't enough, we transition into medication, which is statins. And then if it does get to a point where the blockages of whether your heart, your legs, your neck are at a significant level, which for us is about 75%, then we could talk about stents. So I'm an interventional cardiologist. I deal with stents, and if it's really bad, the blockages, then we discuss bypass surgery. Heart transplants are really for severe cases. I refer for heart transplantation of patients who are very young, who had some sort of cardiomyopathy, some sort of some drastic thing in their lives that fit the criteria for transplants. But hopefully it's preventative, and then stents and bypass. So what are the myths versus the facts? So let's talk about the myth. So the myth is only older people have heart disease. So the fact is that actually heart disease and heart health starts very early on. So there was actually during World War II, they Japanese children that were killed in the war, they did biopsies on them and they looked at their hearts. And at age 9 to 10 years old, the arteries were starting to have plaque formation. So even as a child, even early on, you really have to adapt yourself and really have that mindset of eating healthy, having exercise, and all that stuff. So yes, we think about older people having stents and bypasses, but it starts early on. So another myth: exercise is enough to keep your heart healthy. Um, that's part of it. I think the other part is diet plays just as equally important part. So exercise is important, diet is important as well. Let's talk about another myth. I don't feel sick, so my heart is fine. So again, we talked about the silent killer. Again, blood pressure. You could walk around with blood pressure of 200 and not feel a thing, and it's constantly causing damage to your blood vessels. So silent conditions, as we talked about throughout this talk, can be deadly. Okay, so that was a younger picture of me, I think. Looks good. So I've been involved with Doral for I think from the beginning, from the conception. We built out an extensive cardiovascular department, which I'm very proud of. We here really see the patients and treat them from A to Z, whatever needs to be done. And I'm proud of what we've built, both the non-invasive lab and the nuclear lab, and our whole team. The team consists of me, NPs, the MAs, which are really wonderful, the whole staff, check in, check out, and the whole part of Doral is wanting to not only get the best treatment, get educated, but feel comfortable from the beginning when you check in and until you check out. Okay, so what are the common conditions that we treat here? So we treat coronary artery disease, CAD. So patients come to us and the textbook is the chest pain. But remember, women don't always present with chest pain. So it's something called anginal equivalent. So what we see in movies and textbooks and TV shows is the middle-aged man with who's obese, who comes in with chest pain holding their left side of their chest, right? Women don't really present that way. They present with, I'm feeling tired. I'm feeling short of breath when I walk. And it's our job when a patient comes in, to diagnose CAD, and we have a wonderful nuclear lab which we're able to put patients on the treadmill, or if you can't walk on the treadmill, pharmacological, which means medication. So you don't have to walk on the treadmill if you can't, if you have knee pain, arthritis, elderly, and we look at the flow in the arteries, and we diagnose coronary artery disease both from history and then from actual nuclear testings. We treat heart failure. So if you had heart disease in the past which damaged your heart, or sometimes we don't know what the heart failure reasons are, could cause heart failure in somebody. We're able to medically manage heart failure very nicely with medications and making sure you stay out of the hospital. Our goal is to make sure people with these chronic conditions are seen and treated so you don't go into the hospital in an emergent setting. Stroke prevention, arrhythmia. So patients we see a lot. The arrhythmia is really the younger patients. Sometimes they come in and they have palpitations, and we diagnose them with something called SVT or some sort of arrhythmia, and some older patients with atrial fibrillation. We treat that whether with medications, anticoagulants, and some patients even qualify for an intervention which could zap the electrical activity off of it, and it could prevent that from happening again. So if you fit the criteria, send you for an ablation therapy. Bread and butter is hypertension, so we're good at that. We're able to treat that through diet and exercise. If that doesn't work, we don't jump to medications off the bat, but we try to see it. And there's newer technology that's coming out right now within the last year, which is renal denervation, which patients that are on 3 blood pressure medications, maximal doses, and are still having difficulty managing their blood pressure, there is some technology that you could go into their kidney arteries. It's an invasive procedure. You heat it up, and that nervous system that causes that high blood pressure, you could try to zap it out, and your blood pressure goes down a little bit. Again, that's not for everybody, but we do screen for that in patients. We have referred some patients to that to our major tertiary centers that do that procedure, which is something that's nice to have in our back pocket. Peripheral artery disease. So patients come in with leg pain, they walk, and especially with diabetics or smokers, that peripheral artery disease. And we work closely with the podiatrist. The podiatry department is wonderful. So they see sometimes patients with leg ulcers, and they send to us, and we are able to diagnose it and also treat it mostly through balloons and stents, and we're able to do that. Venous disease, which everybody thinks it's cosmetic, which a lot of times it is, but a lot of times people have leg cramps, and it's something that is bothersome, is symptomatic. So the prevalence of people who get venous disease are women after childbirth. Their veins become a little bit dilated and a little leaky, and we diagnose it with ultrasound. We treat it with compression stockings, and if sometimes after being on compression stockings, whether they can't work or it's just too tight for them, it doesn't treat them right, there's ways that we could ablate that vein and to cure that patient as well of that. And that's something that we're very active and we're really picking up on. And so those are just a few things that we deal with on a day-to-day basis.
We do. It's actually, before I met you, I didn't realize how much of the venous artery is so intertwined with cardiology. So I think it's important for everybody to know this. So it's not just I'm having chest pain. It's not just I'm having shortness of breath. Cardiology is so comprehensive on so many different levels.
Yep. Okay, so a patient comes in, a new patient comes in, we want to look at the basic stuff. We try to do things very basic and not invasive, meaning I don't want to stick a needle in you or send you for a procedure unless you really need it. So patient comes in, we look at the EKG, electrocardiogram. If that's abnormal, then it cues us to do other things. So some of the procedures that we do here that's non-invasive but a little bit more advanced is echocardiography. So echo is basically an ultrasound of the heart, and it looks at the muscle, the valves, the lining around the heart, if there's any liquid around there. It looks at how strong it beats, it squeezes, how weak it squeezes, if there's any valve disease. a prevalence of aortic stenosis as you get older, and when we listen to the heart, we're trying to get cues to see if there's anything called a murmur, which is a flow abnormality, anything that sounds out of the ordinary. We order an echocardiogram, and we have a very excellent non-invasive technician who is able to really get good pictures for me, and I'm able to read it. So those are it's one of the key tests that we do here. So some other non-invasive cardiovascular testings that we do, as we talked about a little bit, is a nuclear stress test. So not a lot of places have it.
I was going to say, this is really special because truly not a lot of cardiologists' office has it in-house.
So there's a lot of, you have to have a hot lab, a technician, a radiation safety officer. Right. There's a lot that goes into it. And in my opinion, I don't think I'm biased, but I think we have one of the state-of-the-art nuclear tech labs, and the technician that comes in, I've known him for almost all my career. He's excellent. He's thorough, and basically what a nuclear stress test does is whether it's on a treadmill or through medication, pharmacological. It looks at the flow through the coronary arteries. So a coronary artery is an artery that's on top of the heart. And if there's any flow abnormalities with symptoms, with risk factors, then that cues us to whether you need a procedure such as a stent or bypass surgery. And that's what we do here very much. And we do some Holter monitoring. So this patient comes in, palpitations. We want to make sure, you're not taking a lot of caffeine, you're not on chocolates. Chocolates could cause a lot of palpitations and excessive amounts. Make sure you're not on any types of medications that could cause palpitations. But once we rule that out and it still continues, we put a Holter monitor on you, which is a constant EKG, which looks at the rhythm. And we see what the rhythm looks like, and if it's something that, and most of the time it's just natural sinus tachycardia, which is a normal response to something, and people are hyperacute to it. But sometimes there's something called an SVT, which isn't dangerous, but you could easily go in and ablate it and cure it. So we're able to diagnose that very easily. And when we talk about cardiac catheterization, if that nuclear stress test or the coronary CT is abnormal, and then also venous ablation. So we do that. We do a great job in screening patients, because believe it or not, a lot of patients come in, they have cramping, and they're like, "Oh, my leg hurts at night," or "I feel ants walking on my chest at night," and like, I don't know what that is, and that could be a sign of venous insufficiency. And our technician does a very good job of doing an ultrasound, and not only just an ultrasound, we do a specific type of ultrasound, which is vein mapping, which really gives me an idea where the issue is and how bad the issue is. And we treat it with medication. We treat it medically with compression stockings. But once that isn't enough, then we could send for ablation therapy.
So you can, like Dr. Hassid mentioned, not only do we have him here and providing his amazing services, we do have a great team of nurse practitioners here that work under Dr. Hassid. Like he mentioned, everything is done in-house. Most things can be done same day. Come in, we could do an EKG right away. We'll do an echocardiogram if needed, of course, and any other nuclear stress test. No, most facilities don't have a nuclear stress test in-house, so we're really privileged to have an amazing center here for that. So before we go to the question mark, our locations, we have 6 different locations, all conveniently located throughout Brooklyn. Reach out to us, reach out to our call center, schedule an appointment, reach out to us even on Instagram. We have a great team that will respond to those messages on TikTok, Facebook, anywhere you hear. We will really want to welcome you to the clinic and make sure that your heart is checked and monitored. And again, like Dr. Hassid said, it doesn't always mean that if you have symptoms, that's your point of coming in. Come in and get yourself checked. Even if your blood pressure is under control, come in and see why the blood pressure is, some days off, or, anything related to even something simple, come in and check, because you never know what can be the underlying cause
So,
for it.
so just to your point, we treat blood pressure, and most hypertension is called essential hypertension, and most people have essential hypertension. But then we do a test here, a non-invasive test,
Renal artery.
renal
I was
artery.
going to speak on that too. Yes, you mentioned that earlier, even to me, and I didn't. Go ahead.
No.
It was very interesting the way he explained it. Is a person may think, okay, I have high blood pressure, no big deal, but we can do an ultrasound called a renal hypertension ultrasound. It's an artery, and it can see if it's anything related to your kidneys, anything related to the flow, and perhaps that can be treated and then addressed.
Yeah. So I've had a handful of patients that
yes.
it's usually for the ones that shoot up. It's called labile hypertension, which means your blood pressure is high one day, low one day. It's all over the place, and they're young, on the younger side. But we've diagnosed it, and it's a special type of ultrasound. And again, our technician, not to say our technicians are the best, but in order to get the results, you need to have a good staff, and our technicians are very, very good at doing the study. So I could see the images. If I could see the images and the flow and the dynamics, it helps me diagnose it. So it's very important.
That's a question. Okay, so we got some questions coming in. So,
hopefully I have the answer.
First question: when you mentioned smoking, are you referencing cigarettes, vaping, tobacco? How does vaping affect nowadays? Taking into consideration that most people have changed from cigarettes to vaping, is it any better, any different?
It's an excellent question.
Yes, I actually like it too.
It's an excellent question. So, not a lot of information is known on vaping per se, but the actual nicotine that enters your body causes these little nicks in the artery. So remember, your body is a heart and has tubes, and it's like plumbing. Just think about it like a plumbing system, right? So the pipes are the plumbing system. So the nicotine goes in and causes little nicks and scratches in the plumbing system. And then if you have a little bit of high cholesterol, it has, and you have diabetes, all those combine to having more sticky particles stick on and have more disease to happen. So those are the most important thing. That's what it is. So is the data out yet for vaping? With cigarettes, with the traditional tobacco, it's been out for hundreds of years, so we know that data. But this we don't really know per se. But if you could extrapolate it, it's just as bad.
And I also read an article that because you're vaping, you can do it in the comfort while you're sitting on your couch, while you're sitting in bed, and people don't realize how much they're actually vaping. One little canister is like equivalent, I think they said, to 6 or 7 full packs of cigarettes. Yes, that's the word I was looking for.
It's easy,
so
it smells
you don't
good.
realize how much more you're actually vaping versus just a traditional cigarette.
Yeah. But I would try to avoid any type of smoking and nicotine into your body.
So our next question came in: do you think we'll have a cardiac catheterization procedure nearly in the future at Doral?
Very, very good. So when it comes to
anything is going to be in the future of Doral. Let's put that out there.
So there is talk in the future whether procedures such as cardiac stenting could be done outside of the hospital. Right. Some states have it: Florida, Texas, Pennsylvania. I think it eventually will come to New York to do. So if it does happen, I think the leadership at Doral is always.
We will be on it. I can promise you that. Once it's okay in New York, we'll likely be one of the first.
With peripheral disease, you could do it as an outpatient. With venous disease, you could do it as an outpatient. With cardiac catheterization, I'm a big fan of outpatient, so I hope it does happen. And I think in the near future, it would happen.
Okay. Risk factors for heart disease and how can I minimize them? Are cardiac ablations a same-day procedure? It's a double question.
Okay, so cardiac risk factors that you could do. So weight loss is very important. Blood pressure control is very important. If you're diabetic, making sure your A1C is well controlled. Making sure, again, exercise, walking, just 30 minutes a day, 4 times a week. simple stuff that could really limit and reduce the cardiovascular risk factors. And if you do have high cholesterol, you do have diabetes, take the medications. And if you need to take medications, take it. Um, so the medications, it's just because you take medications doesn't mean you don't have to do everything else. It's medications, diet, exercise, lifestyle modifications, all that, all in one. So I recommend doing that.
Yeah, and also we're big high achievers people, like I think our generation. It's even like Dr. Hassid mentioned earlier, even parking a block away from your destination and walking that extra block, or having one healthier meal option a week as opposed to constantly ordering out. So
yeah,
it's important.
And the ablation, is it a same day procedure? Most ablation therapies are same day. So if you're talking about heart ablation, whether it's a SVT or AFib, same day. Venous ablations are an outpatient office setting.
Got it. And
most stenting right now, even most of the stents that we do, patient comes in the morning. If it's a not a complex or any type of complication, you can go the same day.
Mm-hmm. Interesting. Next question is what is cardiac rehabilitation?
So cardiac rehabilitation is just physical therapy for patients who had a heart condition. So usually after bypass surgery, we send for cardiac rehab. Sometimes if you have an extensive stent, it was extensive disease. On the elderly side, we send them physical therapy for cardiac patients. And it's a good thing to do after a procedure, especially after bypass surgery. And even if you have something, and we didn't really touch about this. We always talk about stenting and bypass surgery, but sometimes people have 30, 25% blockages, which isn't enough for bypass, isn't enough for stenting, but that's still causing symptoms. Right. And even if you don't have anything, it's something called a significant blockage. There's something called microvascular disease. And patients have that. So a lot of those patients, along with medications and medical management, will help with cardiac rehab and just physical exercise and movement.
Right, got it. I read somewhere. Sorry, you're popular today. The questions are coming in.
Great.
I read somewhere kidney affects the heart. Is that true?
Kidney affects the heart. So yes. So if you have chronic kidney disease, and especially patients who are in dialysis, those patients have a higher prevalence of coronary artery disease, and the whole system, it's all connected. It goes through the kidneys, and kidney does a lot of the filtration and blood pressure regulation and management. So if you do have chronic kidney disease, whether it's end-stage renal disease, not on dialysis, but on dialysis, have a higher prevalence of CAD. Yes. So those patients that come here on our dialysis center, it's we screen them very aggressively.
Understood. Next question is, so we will go into our quiz time. Okay, so what are the warning signs of heart disease?
Okay. Is it a quiz for me or for everybody
else? So maybe I could answer depending on what.
Okay, let's see if you listen.
Oh my God, I shouldn't have offered that. Okay, so what are warning signs of heart disease? Well, I don't want to say warning signs because I do think it's extremely important that just because you don't have symptoms, it's important to come in for a consultation and screen yourself. We have many young individuals that come in, but I would say, like you mentioned, chest pain, shortness of breath. I think that's the two that I can think of right now.
Fatigue, exertional fatigue.
Oh yes, you said the females.
Even males. Why I brought up females is, what they have in February, heart health, women's health, we wear pink and all that stuff, is because if you look at most of the trials that were done in cardiology, and cardiology has done one of the most amount of extensive trials in medicine, women are always underrepresented throughout trials. And now we're realizing that, the chest pain and the elephant sitting on your chest, it's not always the fact for women. And so when a woman, and even a male, comes in and has any type of atypical symptoms, and sometimes it's not even the symptoms, It's when it started and how it's progressing. So, I'm always tired because I'm running around and all that stuff. So that's not a big deal. But if you aren't, and then you say, 3 weeks ago I'm starting to get tired, and I walk up the stairs and I go to walk 3 flights, and I go only walk one, and that change also triggers a higher screening for me as well. So it's symptoms, when it started, and progression of symptoms. That's important.
Right. Understood. I think that is important to think, to monitor, even you yourself monitoring, if something you could have done, like you said, if you normally could have, ran for 15 minutes and now you feel like you're having shortness of breath even after 5 minutes, monitor those symptoms and ask yourself, why is the change, and come in. And you did get another question. So, does the varicose vein cause blood clotting?
Very good question. So before we do the varicose vein ablation, we check for a blood clot. So because the procedure is a low complication, but that procedure, when you heat up the vessel, could cause a blood clot. So it's kind of, I'm answering the procedure first. But the varicose veins, if you have it, it's superficial, and usually it doesn't cause blood clots per se. But before we treat it, we want to make sure you don't have one blood clot. And afterwards, we check for a blood clot as well. And if you do get a blood clot after a procedure, we should put you on a blood thinner for 3 months. We check you, and if it dissolves, you stop off of blood thinners. But the actual varicose veins itself doesn't cause it, but we check for it before we do any procedure.
Understood. The second quiz question is who is at risk for heart disease? Anybody, really. I'm gonna assume that maybe, well, of course, depending on your lifestyle, depending if you're diabetic, depending if you have any other conditions associated. So I would say diabetic, obesity, but other than that, it really is anybody.
So another thing we really didn't talk about, and I'm glad you brought up this question, is genetics.
Mm-hmm.
Genetics plays a very important role. If your mom or dad had heart disease, there's a high likelihood the kids will have heart disease. And not only that, I always ask in my question screening is, any heart disease in the family? If the answer is yes, at what age? And they say yes, dad had it at 50. Mm-hmm. So then if you're 40, it started earlier. So I'm more aggressive screening that patient versus not. So I remember being on call a couple of times and having a patient come in with a heart attack, and he was a marathon runner. Oh my God. Fit, nice. And the first question, any heart disease in the family? Dad had it. What age? 55. He was 54. It was just, it's a very, so who's at risk? Yes, it's the smoker. If you smoke, you're at a high risk. If you're diabetic, you're at a high risk. Genetics and family history, you're at a high risk. Obesity, you're at a high risk. So these are the risk factors that I look at it. But don't forget, your history. If your mom, dad, brother have heart disease, you have to check yourself and let the provider know and be more aggressive with screening and preventative measures. So so the goal LDL is less than 100. Some guidelines are less than 70, some are even lower. So if you have a family history and your LDL is 90, I want it less than 70 for you because of the family history. So I'm more aggressive with preventing from this aspect of it.
And then our last, only 2 quiz questions. Lucky me. So stay proactive about your heart. Do your regular checkups. Healthy eating, like Dr. Hassid mentioned, even small exercise. Stress management is a big one for everybody, but stress management is important. And of course, spread awareness. Be on top. Be in the known of what's normal for you and what's not normal for you. And yeah, we're here. If anything is needed, feel free to reach out to us. We're here. We want to support you. We want to help you provide any care that Dr. Hassid can, him and his team. Follow us on Instagram, Healthcare Unlocked, and our Doral Health and Wellness. Follow us on Facebook. Follow us on TikTok. And please reach out to us. If any way we can help, we will more than likely do so. Thank you again for joining us.
Thank you. This is
and
great.
Until our next session of Healthcare Unlocked next month. Bye, everyone.